3, 2. Hello and welcome to Healthy Seminars. I'm your host, your moderator, Lauren Brown, Doctor of Traditional Chinese Medicine out of Vancouver, British Columbia, Canada. And our guest today is Rebecca Avern. She is an acupuncturist who specializes in pediatric acupuncture. And she's part of our series that we call the What I Wish I Included in My Textbook series. So Rebecca has written a lovely book titled called Acupuncture for Babies, Children, and Teenagers. And today we are going to have her discuss on Shonishin, expanding the clinical applications of gentle treatment. I do want to do a little housekeeping before we go into and I do my formal introduction. So I just want to let you know that on Healthy Seminars, we do have a section called Resources. On the home, you go to the resource page, and if you scroll down, you can go past the topics, or you can use these to find things, but the calendar will tell you what's happening in the live events. So you can see here we are today, September 10th, with Rebecca. She's also going to be back with us on September 24th talking about eczema. And then you can see here where we have other courses. For example, I'm doing a workshop this weekend. And if you click on the next button, you can go into the month of October, and you can see our upcoming live webinars that we've scheduled. We keep adding, but I do want to let you know in our upcoming live webinars, Rebecca is part of that. And on October 11th, she's doing a CEU PDA approved live webinar on acupuncture for childhood and teenage anxiety. And I think with what's happened with COVID and the pandemic in 2020, that this course is so needed, is being observed, whether it's in the medical world where they're actually really collecting data, or those that have children are noticing this in their children, that they are being affected by the isolation, the fear, and everything that's going on in our world. So a very timely course, and thank you, Rebecca, for putting that together. We do this recording will be available to you for 48 hours. So I do want to let you know that it's September 10th today that we're filming this live. And if you go to the resource page and then click on the link into that calendar, you'll find the recording. Or you can go to healthyseminars.com/wish. So the end is wish/wish. And it'll take you to this page, and we'll have the recording up here. We're going to keep it up for 48 hours to September 13th. I also want to let you know that if you stay on to the end of this short little lecture, we have a special, gift or offering for you guys. So do stick around to the very end. And I do want to let you know that Rebecca does have some other courses available on Healthy Seminars on demand. The importance of nurturing the young to raise happy, healthy children, as well as pediatric insomnia, using acupuncture to help babies, children, and teenagers sleep. And as I mentioned, on October 11, 2020, she's teaching acupuncture for childhood and teenage anxiety. So just a quick disclaimer, I want to let you know that this is for educational purposes only. This is not meant to be medical advice. If you have a health condition, please do seek out a healthcare provider. Again, this is for continuing education purposes only. Now, as I mentioned, Rebecca has written a textbook. She's an acupuncturist that specializes in pediatrics and childhood conditions. She's a lecturer. She's an author. She has other books on the go. And she's a wonderful person and a colleague to learn from. And we've had her a few times on Healthy Seminars, and we're so glad to have her Zoom in again from across the pond compared to where I am to offer this. So, Rebecca, I have a question for you. You've written this textbook, you've written this book. What is it that you wish you would have included in the book now that it's published and it's a little bit after since this book has been released?
Okay, thanks, Lorne, for the introduction. And I'm very happy to be here on your birthday, particularly.
Thank you.
So, yes, tonight I'm going to talk about what I wish I had included about Shonishin. So, when I wrote my book, I was using Shonishin in my children's clinic as one of many different modalities that I use, but I was using it in a much narrower context or in a much narrower way than I do now. So that was a good few years ago, and since then I've come across other approaches to Shonishin. I've got a few more years experience of using it, and I've expanded the way that I use it. So that's what I'm going to talk about tonight. If I can get, oh, there we go. Okay. So when I wrote my book, I used Shonishin largely as a way of regulating the movements of chi in babies and young children, which is the way that Stephen Birch describes the use of Shonishin in his wonderful book about it. And it's something that I still use it for. However, there are lots of other ways of understanding it, lots of other kind of lenses through which we can view it. So, for example, Yonayama and Mori talk about it being a way of stimulating the peripheral nerves. A German author called Wernitzka talks about Shonishin having the ability to balance the autonomic nervous system. And also he stresses the fact that it releases oxytocin into the system. And then Alex Tiberi had a more kind of TCM way of understanding Shonishin. So he talked about the tapping aspect of Shonishin having the ability of bringing heat to the surface, and then the stroking moves then clearing that heat out. Jake Fratkin talks about using Shonishin to disperse yang and nourish yin. So there are all these really quite different ways of describing the technique. And of course, the reality is that Shonishin can do all of these things. And the key question to ask is, when might we use Shonishin with each of these different effects in mind? So when we're treating, for example, a newborn baby or even a prem baby, we might use a gentle Shonishin routine just to regulate their chi. So they're almost too young for us to really make our normal kind of TCM 5-element differential diagnosis. But we want to do something to help support them in the first days, weeks, or months of life. So to give you an example, during lockdown, I was contacted by a mother who had had a very traumatic birth in hospital. She'd had a placental abruption, and her baby was born with many profound problems, no gag reflex, no sucking reflex, etc. And her baby, the doctor said that her baby would probably never leave the hospital, and that she would only live a few days or weeks, and it was a desperate situation, and the mother was stuck there on her own during the height of lockdown. Her partner couldn't visit her, and she said, is there anything I could give her to possibly help her baby? So I just taught her over Zoom a really simple Shonishin routine. I hadn't met the baby, I couldn't see the baby, just to help to regulate the movements of chi, which in young babies is very much about bringing chi downwards and kind of helping to direct it to the core. And I taught her this routine, and she did it twice daily. She said the nurses would come over and say, and notice the change in her baby. And after about a month, she actually went home with her baby. Her baby's doing really well, has superseded all the kind of expectations that the doctors had. So that is the power of a really basic Shonishin treatment. And in that situation, I didn't have enough information, not being able to see the baby, to do anything more specific than that. I often use Shonishin in children who are on the autistic spectrum or who are highly anxious, because it has a really powerful ability to regulate their nervous system. And also this is along the lines of what the German author says of Shonishin about releasing oxytocin into the system. So I remember once a 14-year-old girl coming to my clinic who was on the autistic spectrum. Her body was so tense and tight that she literally was like this with her fists and her toes kind of clenched on my couch. And she took her shoes off but wouldn't take anything else off. She wouldn't look me in the eye. And I just started doing some gentle shonishin through her clothes. And her response was to have a fit of laughter. And I put that down to the ability of the shonishin to release oxytocin. So in that situation, I don't think there's much else I could have done with this girl in terms of treatment, in terms of what she would have accepted. But this just made her system completely relaxed. She unclenched, she began laughing, and then that paved the way for me to do more treatment. I might also use Shonishin in a child who has some lingering pathogenic heat that I have struggled with other methods to kind of bring to the surface of the body. So they're perhaps a deficient child, but they also have some heat in them. And Shonishin, this is more of a kind of TCM way of using Shonishin, can help to promote that heat to come to the surface of the body, and then the stroking movements can help to kind of stroke it off the body. And when I wrote my book, I never used to use Shonishin in acute conditions. So when I originally was taught it, I was actually warned against using it in fevers and other acute conditions. But I've now found that it's a wonderful way to support a baby or a child through an acute condition, because in young children, all acute conditions manifest really with an excess of yang and a background of a deficiency of yin, because the yin is insubstantial and immature in children. So you can use Shonishin to help get rid of some of that excess yang and boost the yin to then kind of cool and calm the child. And sometimes if a child is in the midst of a fever, for example, and very agitated, then that's far more acceptable to them than needling might be. So at one point in my Shonishin journey, I was feeling really confused because I'd heard so many statements about how to do it. Some of the things I'd heard was to only ever do it on the yang channels or the yang surfaces of the body. I also heard do it on the yin and the yang channels or surfaces of the body. I'd heard it said that you should only ever stroke downwards with Shonishin. And I'd heard other people say, oh, the direction doesn't matter. I heard some people say and read some books that said it doesn't work at all above the age of 4. And I'd seen in one book that it can be used throughout life on, children and adults of any age. And I heard someone else say it's just like pediatric tuina, but it's quicker and uses tools. So I was trying to kind of work out what I really thought about it. And so I have come to a place now, and I would imagine in 5 years' time, I'll be in a different place with it, where I use Shonishin on the yin and the yang channels and surfaces of the body, not only the yang ones. I do largely, when I'm using stroking methods with Shonishin, go downwards, because that helps to counteract the natural tendency of a child's chi to go upwards. So I think direction does matter. Although I also sometimes use a kind of side to side movement when I'm specifically dispersing yang in acute conditions. And I disagree that it doesn't work above the age of 4. I think that what's important is the child's energetic or developmental age rather than their actual age. So I regularly use Shonishin techniques with teenagers, particularly like the girl I mentioned earlier, teenagers who are on the autistic spectrum or are developmentally behind their peers in one sphere or another. And I find it really effective. And because teenagers have an abundance of yang in the same way that very young children do, I think that Shonishin is brilliant for them. And I don't really agree with this last statement that Shonishin is just like pediatric tuina, but quicker and uses tools. I think it's got some inherent but fundamental differences. And actually, it's thought that Shonishin wasn't very much influenced by earlier Chinese medical texts at all. So it doesn't really come from a very kind of TCM background, whereas pediatric tuina does. And with pediatric tuina, you can be very specific about treating patterns of imbalance. Whereas with Shonishin, your treatment strategy tends to be a more general one. For example, you want to bring chi downwards, you want to help regulate the nervous system, that kind of thing. So the conclusion I've really come to is that, and this is in a sense true for all of us with the entirety of our acupuncture practice, but I think this particularly applies to Shonishin, that we really need to find our own style and our own way of doing it, and that we need to do that through using it and through being flexible in our approach to it, learning from our results, taking note of what works and what doesn't work, and adapting that accordingly. And most importantly, responding to the needs of the child that's in front of us. So I think that Shonishin can be many different things to many different practitioners and can be used in many different ways on different children within the parameters of this specific modality. And last but definitely not least, sometimes an entire Shonishin treatment, which is all I might do in one treatment, takes all of 1 minute, literally 60 seconds, and you're done. And it can be hard as a practitioner if a family have traveled, for an hour or whatever to get to you, and you're, charging them a certain amount of money to do a treatment that takes 60 seconds. But I have been very interested in the last few years in reading more about touch. And some of the things I've learned help me to have the confidence to do such minimal treatment. So I just want to say a few things about touch, and Shonishin is a form of touch, and sort of non-Chinese medicine related effects of touch. So these things have been categorically kind of scientifically proven that touch promotes healthy brain development in babies and children, particularly the parts of the brain that help to manage social interaction. That touch plays a big role in reducing anxiety and pain. When babies and children experience touch in early life, it helps them to establish a clear boundary between themselves and the external world. So it helps to kind of make that membrane between them and the world. So that they can allow sensations and experiences in, but also be defended against anything that's too much. And touch also helps children to inhabit their physical body and to feel comfortable in it. And actually, we know from the tragic experiences of babies in Romanian orphanages, for example, that even babies that are given food and kept clean can die if they don't receive touch. So just getting food and sustenance and being kept warm and clean is not actually enough for survival. Touch is as crucial an ingredient for survival as all of those other things. So when you're doing Shonishin, you are actually helping a child in all of these different ways that are hugely important for their future development. So if your treatment only takes a minute, you need to remind yourself of what an important thing you've done in that minute for that child. And of course that we can teach parents to do Shonishin at home as well, so that children can get the benefits of it on a daily basis. So that is what I wish I had included about Shonishin in my book.
Rebecca, thank you very much for sharing this with us. And before we go into a few questions, I wanted to remind you guys that I said I would have an offering. And so as some of you are aware, today is my birthday, and I chose today to do this with Rebecca because this is how I want to spend part of my day with my birthday. And when I treat on my birthday, when I'm in the clinic, we don't announce it, but patients get a surprise. Whatever my age is, and I'm treating on my birthday, is what they get off on their treatment. And so I've been in practice now over 20 years. So it's getting up there for my my patients when I have my birthday. And again, we don't do it to bring them in. They don't know. They go out and then they're like, what? And because it's part of what one of my mentors said, always be of service to others if you want to have a fulfilling life. And so I don't take my birthday off from the clinic. I actually do my best to treat on my birthday and give that discount. You guys are here on Healthy Seminars. So what I want to offer for you guys is a few things. So we're reactivating for you guys that are here at the live webinar and they're going to watch the recording. So it's only going to work now until September 13th, 2020 at midnight. We're reactivating the coupon Healthy 2020, Healthy 25 is the coupon, and it gives you 25% off of Healthy Seminars, as well as I have my workshop this weekend. This is a gift for me to do this workshop on manifestation and consciousness. And we've extended that early bird as well for today. So I want to let you know that's available. And then Rebecca's upcoming course is on early bird savings. So there's an opportunity for you guys to save. If you join me in my workshop, I think you will be satisfied. I've done it a couple of times, and I think it'll be something it's a gift for yourself, but definitely a gift for me to prepare it. And again, that coupon's available for you guys. So I just want to let you know, if you're interested in taking any courses through Healthy, that coupon has been reactivated for you guys as well. I'm not going to give you my age off on the courses because when I do my treatment, it's me, but I have speakers. And so I haven't negotiated or discussed with them that I could give that high of a discount off because I'm getting quite old. So 25 hopefully is generous enough for you guys as well. Please continue to check out our resource page on Healthy. We got a lot of stuff coming up on live webinars for CUs, and I got a bunch of stuff planned as well. So there's going to be a lot of stuff, fun stuff happening for you that will hopefully benefit you, create value for you. so you can go out and heal your communities. Rebecca, I had a couple questions for you before we wrap this up. Oh, and I want to remind you guys, for her book, Acupuncture for Babies, Children, and Teenagers, you can get that either through Singing Dragon or Amazon. So do check out Rebecca's book. It's an excellent book on treating kids in pediatrics. With the Shonishin, do you have yourself any videos available for people to look at demos, or is there anybody on YouTube that you like that you would recommend us to go see Shonishin in action?
Yeah, that's a good question. I do have some videos, and so I'm in the process of putting some up on my website. But if I forward you one, Lorne, is it possible to?
Yeah, we'll include it with this, and maybe that's a future fun little talk too that we can do, where you just show a few case studies, because I think observing can really help as well.
Definitely.
And then for your you said Shonishin is not just for like 4 years and younger, and so it's a two-part question. Because of the environment that we're in, the anxiety and stress for some people, how they're experiencing life today. There are some attachment therapists that say that children express what's between the parents and behind the parents. So would this be a prophylactic type treatment as well, just to start treating these young children, because their parents, although they may be putting on a brave face, they tune in and can feel this stress and anxiety? So any advice around prophylactic, just supporting children during these exceptional times that we're in?
Yeah, definitely. So doing a very basic, what's called a non-pattern based root treatment, where it's applicable for pretty much any child in any situation, you don't have to kind of make a diagnosis, is a lovely prophylactic treatment. And as I mentioned earlier, it helps to make the membrane, what we would think of as the wei qi, really, between the child and their external world, appropriately open and closed. So in terms of when there's all of this intense emotion in the ether at the moment, it would be, and it is, a wonderful prophylactic treatment, just so that it will help to prevent children from absorbing too much of it. Children are like sponges, and anything we can do just to kind of give them a little bit of a more energetic protection at the moment is really valuable, and Shonishin's definitely one way of doing that.
And then last question we got here is, when you do a treatment, a Shonishin treatment, do you have a tool that you prefer? What tool are you using to treat children?
So my preferred sort of official Shonishin tool is called a Yonoyama, Yoneyyama. But I frequently use shells. So I have a collection of shells that I've collected over the years. And you can use the back of a spoon, you know, a nice kind of soup spoon like you get in Chinese restaurants is also good. When I'm doing tapping techniques, I suggest to parents to use what we call Kirby grips, hair grips with a kind of open end. I don't know if people know what they are. So, but that's another way in which you can be flexible. Anything with a smooth surface that you can hold in your hand is fine to use as a Shonishin tool. And it's a really nice thing to do, to have a bit of a collection of different ones and to ask kids to choose which one they want you to use, because then you're giving them a little bit of power and control, which is always a nice thing for kids to have.
Rebecca, thank you very much for sharing with us what you would have wished you've included in your textbook. Rebecca's coming back on September 24th to offer another lecture on this series, and it's going to relate to eczema. So do tune in, register. You can register for that, I think, believe now, so you can get the Zoom link and the reminder. Again, this will be available for you for 48 hours on the healthyseminars.com/wish page, and check out our upcoming live webinars. My workshop, because we got the question, it's actually on a different website, laurenbrown.com. So if you're looking for that website, that workshop I'm doing this weekend, it's on laurenbrown.com. And just off topic, but I just released today, I did an interview on psychedelics for healing and tapping into consciousness under my conscious talks with Gillian Maxwell. And John McMichaels I interviewed, and that's going to come up. His name's interesting. If you heard of Bill Bankston, he talks about him a bit. John, he's a immunologist and virologist, and he's created a remedy that's now at FDA. I think it's phase 2 or 3 for treating viruses, including COVID, and non-pharmaceutical style. It's resonance bonding. I don't know. It's quantum level, a little bit outside what I understand, but that's also going to be on laurenbrown.com, Conscious Talk. So I use that website to look for some things that are on the fringe, a little out there during this paradigm shift. So if you like that kind of stuff, quantum healing, check out laurenbrown.com for that information. We're constantly interviewing and posting that. And again, Rebecca's book is available on Singing Dragon and on Amazon. And then Rebecca has a few pediatric courses on Healthy Seminars, so please check those out. And thank you guys for tuning in and participating in today's series of What I Wish I Included in My Textbook. Until next time, thank you.